Well, you're watching the BBC News Channel with me, Ben Brown. Now, let's get more from the Health Secretary, Matt Hancock, who, as we've been hearing, has been speaking to Andrew Marr today, warning that the measures the government will take to combat the coronavirus will disrupt the ordinary lives of almost everybody in the country. He confirmed that in the coming weeks, older and vulnerable people would be asked to self-isolate.
Quite soon, anybody over the age of 70 is going to be asked to stay inside the house for up to 4 months. Is that a realistic thing to ask to do?
Well, the protection of the vulnerable and elderly by asking them to stay away, to stay at home, that is in our action plan. But we do not want formally to say yet that people should do that, and the reason for that is simply this length of time that they need to stay self-isolated, stay at home to protect themselves. It is a very big ask. It's a very long time, and we do know that if you ask people to do this sort of thing, then they can tire of it. We know that it has negative impacts and real negative impacts. Yes.
Because it's sorry to jump in, but it's not just all of those millions of people staying inside their houses. It's also presumably anybody who is caring for them. There are 5 million carers in this country, 600,000 people caring for someone with dementia, but there's no point, obviously, in asking them to stay inside their houses unless you're taking the same measures for those who are going to be bringing in food, helping change their beds and so forth.
Well, you've got to make sure that people, if they're staying at home, get the support that they need, of course. And that isn't just going to be the social care system. We're putting a huge amount more extra cash into the social care system. But it isn't so much about the money, it's about having the people. So we are going to need a massive community response.
Well, that was Matt Hancock, the Health Secretary, speaking to Andrew Marr. And our political correspondent, Nick Eardley, has been telling me the thinking behind the government's latest announcements.
The argument that ministers are continuing to make is that they are going to be guided by science. The message from Matt Hancock this morning was they are absolutely prepared to take whatever action is required to try and stop the spread of coronavirus, but they want to do it at the right time. Now, as you say, I think it's fair to say that the criticism and the questioning of what the government has been doing has been increasing. We've been hearing from politicians and others, some of our viewers I'm sure, who want to know more about why the government is taking different measures to other places in Europe, for example. Now, the immediate response to that is the government is going to publish more of its scientific advice. But I think we are going to see over the next few days and weeks a ramping up of the measures designed to help stop the spread of the virus. So Matt Hancock saying this morning that in the next few weeks we're likely to see elderly and vulnerable people asked to self-isolate, potentially for quite a long time, potentially for a period wise. The advice is likely to change some point soon from what it is at the moment, that if you or I have a fever or a cough or to stay at home for a week, that will change to mean that if someone in your household, maybe a family member or a flatmate, something like that, if they have symptoms, then you're all supposed to self-isolate. Now, we don't know exactly what that will look like, and it's important to say that that advice hasn't been issued yet, but I think more is coming, and it's clear the government is starting to ramp up its response.
And some of the papers today evoking a kind of wartime spirit, and in terms of specific measures, the government are calling on big companies to start producing ventilators, and they're also trying to see if the NHS could use private hospital beds. They're trying to get everybody working together on this.
Yeah, that's right. I mean, the Health Secretary also using that wartime comparison, saying that the country almost needs to draw on the Blitz spirit from the Second World War. I mean, I think it's fair to say that the government thinks this is the biggest health challenge in a generation, and for all of us, for you and I, for our viewers, there's going to be a massive effort required, that everybody needs to, sacrifice something over the next few weeks. The first step of that is asking major manufacturers to make ventilators. The UK has about 5,000 at the moment. There is a feeling there needs to be far more. So the government's basically saying to anybody who can make ventilators, do it. No matter how many you make, we'll buy them. Likewise, they're saying to private health companies, to private hospitals, we might need some of your beds, and putting in place measures to make sure that if NHS beds are full, some of those private health service beds can be used as well. Absolutely, the government is starting to really move up a gear in its efforts to tackle the virus. But as I say, there continues to be that questioning politically and some medically as well, saying we need some more information and perhaps to take some extra measures, and the government is still facing questions on that.